Still walking. About 4 months ago, I wasn't walking at all. I'd suffered a multiple sclerosis flare-up, the worst I'd experienced in the 14 years since I'd been diagnosed. My neurologist got me walking again. And then he recommended the new drug, Lemtrada. Lemtrada treats the relapsing form of multiple sclerosis. I'm told if you've had a flare-up in the last 2 years, you may be a candidate for this drug. I'm not a medical doctor, but from what I understand, Lemtrada, formerly known as Campath, is a cancer drug. It has been used to treat graft versus host disease. I was treated at the Comprehensive Cancer Center at the University of California, Davis Medical Center. Lemtrada is given by infusion over a 5-day period. The first day is important because the nurse will place the intravenous port that may be there for 5 days. Lemtrada is light sensitive. That's why it comes with a brown wrapper around it. Am I in your way? You want to pass me? Oh. Now I'm in your way. The first 3 days, you'll be there a minimum of 8 hours. So if you can walk, you may want to get up and move around. Some nurses will wait 1 hour for the Benadryl and Tylenol to become active before they start the Alemtuzumab.
You making a picture of that?
Yeah.
Or you recording?
I did a recording of that. I made it. So far, so good.
Like if you put your finger right where that, can you feel that little bit of vibration going through?
I have very numb hands. So
Oh, well then probably not.
Day 2 of Lemtrada. Here we go. Benadryl that I will quickly swallow. So we don't go through that again. I had dropped my Benadryl on the floor that day. Saw your Benadryl started, and I've taken the Benadryl, and I get Tylenol at 11 o'clock. Here we go. If you're going to use the original port, keep it clean and dry. On day 2, I had a pretty severe headache. Here is just one of the excellent nurses I had.
Okay, I'm going to ask for your help. One is smaller, which goes to the bottom, and one is slightly bigger. I gave you the smaller one just because of where it's at. You will have to stretch it some, and you might need some help getting it over.
Will it recover too?
It'll come back some, but then you might have to add a little bit of tape around it. But same thing, there's the two sides, two ends to it. And then there's some pictures. So, a couple of different things to use. Some people just like to wrap it with like plastic wrap, or the Glad pressing seal works really well. It kind of sticks a little bit, and then kind of tape around the edges. There's your goodie bag for the day.
There I go. All right. Are we free to work out again?
You are free.
All right.
Thank you.
Thank you. Day 3. They will regularly monitor your vitals, temperature, heart rate, respiration, blood pressure, and oximetry.
Get to your arm. Alright.
The blood pressure and everything will all be pretty good.
Good.
Alright. Can I get you anything while I'm over here?
I think I'm all set.
Less than 1 hour. So it's an hour for the pre-meds, an hour for the Solumedrol, 4 hours for the Lemtrada, and 2 hours observation time minimum. Your days will be 6 to 8 hours long. Bring something to eat. I'll come up with some good numbers here. So I can get out of here.
Oh, what?
Day 5. Day 5. Have a rash.
Yeah. Which
Which isn't very visible here, but I do have a rash. Rash on my back and belly. Itchy. Cloudy.
Hello, Marianne. Can you please tell us your full name and birthday?
I could in the past.
So I just printed out the ones that are greater than 10%, and then in the parentheses it shows you the number of patients in clinical trials that got it.
Oh, okay. Great. Thank you very much. Side effects.
Really, the main thing that works in this room is the station, but
Okay, so I'm done with the infusion. Day 5 done. And now I'm waiting for this to finish up. And then I start the 2-hour observation. And then I'm out of here.
Is it right if I start hooking first?
They can't find the manual blood pressure machine.
Right, 90 degrees.
All right, going up.
Yeah, that's good.
That's typical. That's the Tylenol wears off.
I got 90 over 64.
Pretty good. Day 5. Hour and 54 minutes. Abandoned. Nobody's home but me. 1:18. Yippee. After 5 days, we have how many minutes? 17 minutes.
You guys never called me back?
Of
What
course.
I'm going to do is I'll send him what we call staff message, basically an email, in our system email, asking him and informing him, letting him know that he's to the lab she's supposed to have done. Can you please come
It's time to
in?
go.
You can follow up with him in a couple days.
Yeah.
Make sure he's done.
I figured I would actually, because I know he has clinic when he's here. He has clinic on Tuesday, so I figured that would be a good time to call.
He might just not even have his pager on him. He might just be out.
98 oximeter and 60 symmetry.
One more time.
One more time. Okay, here we go.
There I am, back for a whole nother year.
Yeah.
We'll see you.
She packed all her visits into 1 week.
Very good. Well, have a good weekend.
I'll probably be thinking by then, oh, wasn't that bad? Oh, yes, it was. Now I have to do it again. Other than some trials they may have conducted, I was told I was the first patient at this institution to receive a Lemtrada infusion. All right. Whew. Got that over it.
I did SOS night, so Paul Franken, the last part of his name, I can't remember it right. He was my like
But it was a good placement because it did well.
It worked well, yeah. Not in an area that you bend, so it
Right.
kind of just stays where it's supposed to stay. Well, it was a pleasure working with you. I hope everything goes well.
All right.
okay?
Thank you very
See
much.
you back in a year.
Okay. The average age of the patients in the 2 trials for this drug was about 20 years younger than I am. So my doctor says, because of my age, the drug won't be as beneficial as it would be in someone younger. You will be unlikely to find someone as anti-pharmaceutical as I am. I don't like putting foreign things in my body. So my choice was disability within months or Lemtrada. It's good to be walking. It's good to have hope. Don't you think? Genzyme, who makes the drug, requires entry into a program in which you will be monitored for 4 years, monthly, in terms of blood and urine tests. It's good to have hope.